increasingly nice, I think more people catch up and watch it at an hour that's more convenient to them. But it's nice to welcome those of you that have joined us this morning live. So as you know, we've been putting on a number of topics for a long while. And one of the things that's really important to us is mental health. Because whilst there's been a physical impact of COVID, there's also been a psychological impact of what we've been going through for the last more than a year now. And I think it's important that we address those aspects of our health. That's not just physical. It's really important for us to look after ourselves. So I'm delighted to welcome a colleague and a friend, Dr. Joe. Morning, and how are you? Who's going to tell us a bit about how to look after the psychological aspects of our health this morning. So I'm going to hand over to you now. Thank you.
Thank you, Ngozi. Good morning. Good morning, everyone. Like Ngozi has said, my name is Joseph Omofuma. I am a GP based in sunny Rochdale. Hardly ever sunny in Rochdale, but we like to be hopeful. I'm based in Rochdale, and my special interest is mental health, as well as family and reproductive medicine, but sexual health, mental health mainly. So I'm the mental health lead for our practice, and I sit on a few committees and boards in that area. I see myself as a mental health advocate. I know that we've had some excellent speakers in the last few weeks. Last week, you had the esteemed Dr. Eric Osima, the renal specialist, I believe. And then my good friend, Dr. Mo Kamara. There are very few people as nice as Mr. Kamara, if you ever get to meet him. So today, I want to try and I like to keep things simple. Thank you for the introduction, Ngozi. Today, I want to talk about mental health, the silent affliction or the silent crisis involved in it. It's interesting you mentioned about the psychological aspects, because in my previous talk, I had given some tips around that actually, and I was looking at that thinking, okay, should we still talk about that? We'll probably mention a few things, but what I plan to do this morning, if it's okay with everyone, is to attempt to shine more light on the issue of mental health and the problems associated with it, the fact that it's happening around many of us, and sometimes we're just not seeing it. I will try to share my slides if I am able to do so. If not, I will just keep it slow. And if you have questions afterwards, we can chat about it, if that's okay. So mental health, the silent affliction or the silent crisis. Unfortunately, mental health is still associated with a lot of stigma, especially within the Afro-Caribbean community. I mean, it's associated with stigma, period. But in the Afro-Caribbean community, it's unfortunately even worse. This is evident from both the people who suffer with mental health and the people and the general population. In other words, what I find is that people who are suffering with mental health are reticent to come forward to talk about their mental health themselves. They also are not very keen to actually talk about the mental health. So it's a bit of a problem, because the people who suffer with the mental health don't want to talk about it. They're not keen to come forward, and it's an ongoing problem. Mental health is generally poorly misunderstood. You know, if your arm is bleeding, people sympathize with you. If you are giving birth, people will sympathize with you. If your child is sick, people will sympathize with you. But it's a bit more difficult to understand when it's something that is a bit more intangible, but it's something that affects every aspect of our existence. In other words, you can't see what's going on in people's minds. We don't know what's happening in people's hearts. And so it's a bit more difficult to really understand. And even among clinicians, it's not something that is, very popular among, especially my colleague GPs, I must say. Many people shy away from the topic. The way I tend to look at it is that mental health is like any other illness. When you come down to the nitty-gritty, it's basically like any other illness if you look at it carefully and if we try to understand it. So today, what I want to try to do is, like I said, is to shine more light on this growing epidemic, and hopefully we can advance a bit of our understanding on the subject. One of my favorite definitions of mental health is this one here that I'm sharing with you in my slide, which says that mental health is defined as a state of well-being in which an individual is able to realize his or her true potential and is able to cope with the normal stresses of life, work productively, and make contributions to society. I want you to look at my definition very, very carefully. It's a state of well-being in which an individual realizes their true potential, they're able to cope with the normal stresses of life, work productively, and then contribute to society. From my little experience as a GP and as a doctor in general, is that a lot of people suffer with mental health and they're not even aware of it. A lot of stuff is going on and people are not even aware of it. You know, talking about things like PTSD, that's post-traumatic stress disorders, anxiety, depression, undiagnosed autism, ADHD, bipolar disorders, obsessive compulsive disorders. You know, what we see is the manifestation. We see people manifesting the signs and the symptoms. A lot of people don't actually know that they're actually having a mental health disorder. And it's unfortunate because it then, until it begins to affect family life and, you know, their productivity, their ability to cope, people don't often recognize this as being mental health. Mental health is often stigmatized. Some people think that if you have mental health, that means you're weak, or, you know, you're not as strong as everybody else. But I beg to differ. From the little bit of experience that I have seen the strongest of people. I have seen the richest of people, the poorest of the poorest of people suffer with mental health. So no one is really spared in this. The average in the UK says in a lifetime of an adult, between 25 to 33% of us will suffer with mental health or depression at some point in our lives. Let me just clarify that most mental health features are found in people who are not suffering with mental health. Yeah, most of the features you'll find. So the distinguishing features are often the fact that those things are sustained and it becomes debilitating. In other words, it starts to affect your day-to-day existence. I'll give you an example. Many of us get anxious. I mean, I get anxious. Just my child going to sit for the 11+ exam, I was more anxious than him. But that doesn't mean I have an anxiety disorder. That's just a feeling. Now, when you are anxious all the time, when that feeling is sustained, and then when that anxiety begins to impact your ability to actually be able to function on a normal day-to-day basis, that's when it becomes an anxiety disorder. And that it's really important to clarify that, because a lot of times people read things on the internet or they Google things and they say, oh, I have that. That means that doesn't necessarily mean you have mental health, because we have some people who are very keen to either label themselves, but the opposite is often more true, where people have the symptoms and we're running away from it. So a lot of people have the similar symptoms. One of my favorite psychiatric symptoms is excessive prayerfulness, which is found in some schizophrenics. Now, if you go to the local Christian church, or you go to the average mosque or Sikh temple, a lot of people like to pray. Does that mean they all suffer with mental health? No. But when it begins to be prolonged, sustained, and it affects, you're not eating, you're not drinking because you're praying. You're not going to school because you're praying. You cannot sustain a relationship or a job because you're praying. Then there's a bit of a problem there. I hope that's a bit clearer. So these are some of the important points that I think we should look at. Let's look at stats. I like to show people stats because sometimes we sometimes are not aware of the things that are going on. Let's look at some stats. Now, suicide now ranks the third leading cause of death in 10 to 24-year-olds, according to a lot of papers coming from the United States. Suicide, that's people who want to harm themselves or kill themselves, is now the third leading cause of death. That's massive. In people under the age of 25. Suicide, depression has tripled in the last 40 to 50 years. Now, in the UK, the highest cause of death in men under the age of 45 is suicide. The highest cause of death in men under the age of 45. To me, that's massive. Okay. If you narrow this down, the ages of 40 to 50 is where you get the most numbers of suicides. So there is a lot of stuff happening amongst us. The British Psychological Society calls this the silent epidemic. It's happening all around us, but we're not seeing it. I must say also that middle ages is where we tend to see a lot more of the suicide. But unfortunately, in the younger age group, which I'm very keen to pay attention to, it's rising on a daily basis. It's getting more and more and more. And my aim really is, everywhere I go, is to try to shine more light to the fact that these things are happening all around us, and we need to be more sensitive to it. I just thought I should add, what are some of the risk factors that can lead to suicide? You know, what are the things that, because suicide is like the ultimate end, as it were. If someone decides to take their lives, there's no way back from that. They've ended their lives and there's no coming back. And so, I mean, there are other obviously debilitating things. There are other things that people can do that harms their mental health. But by the time you kill yourself, it doesn't only affect you. It affects your family. It affects your friends. It affects your community. So I just want to shine some more light on that. So risk factors include previous mental health problems such as depression, which often manifests in irritability, anger, or outbursts or hostility. Another risk factor is relationship problems. And this is massive, not just in the Afro-Caribbean community, but all over. This is across board. It's massive because a lot of times, I would rank this perhaps one of the highest in the under 50s, where relationship problems, breakdown in relationship tends to be an aggravating factor. Social isolation or incarceration, that people who get the wrong side of the criminal justice system. But social isolation is a biggie. I have talked about this in the past, how important isolation can be. Substance abuse, such as drugs and alcohol, is an important risk factor, because when you take these substances, we're not able to think clearly. We're not able to process things in the right way. And so what you find is that people are not in their right minds, and they don't see any hope for the future. And so they want to, commit suicide or do something worse. Access to medications or weapons, is also a factor. Also physical illness or disability. People who suffer with chronic illnesses, chronic disability, they're often a suicide risk. I'm mentioning all this so that those of us in the general public can begin to see and identify those things around us, because as a community, I believe that one of the best ways of dealing with this is to band together, identify these things, and hopefully try to prevent them. There's no point us just talking about this thing. We need to be able to see it from afar when it's coming. When somebody starts abusing drugs or abusing alcohol, they're pushing themselves towards a point where things can go wrong very, very quickly. The loss of a friend or family member is another risk factor, or previous attempted suicide. Not many people handle death very easily, especially death in the family. And so it's important to mention that many people have issues, and then unresolved conflict tends to be an important factor. Let's quickly talk about COVID, because we can't escape the COVID. A recent survey showed that as many I think I was muted inadvertently. Okay, yeah. So a recent survey showed that 2/3 of people admitted their mental health had deteriorated as a result of the global pandemic. That's 2/3 of people. That's 1 in 3 people, 2 out of 3 people. They said, look, COVID has affected their mental health. Also, there's been a sharp increase, almost double, in self-harm and depressive disorders as a result of COVID. There's ongoing research to suggest that there's a direct link between the coronavirus itself and how it affects our mental health and neurological system. Now, how do we prevent this and how do we recognize this? Prevention and recognition, which is where I think, but also I want to shine some light before we go also on a couple of other things that I think might be important. But how do we prevent this? How do we go about hopefully trying to stop this? One of the things that we learn in mental health is that if someone is bent on harming themselves, there's very little that you or I can do. But we can help them before things get to a critical point. Now, I said that one of the best ways of preventing is to look at all the risk factors that are there and try and avoid them. So it's easier said than done, but relationship issues before they escalate to the point where they start affecting your mental health. I often say to men, women who are being abused or who are in an abusive relationship, because I'm also a pastor and I see these things, it's sometimes to preserve your mental health, it's better to leave that situation. Some people are in some jobs where there's a lot of bullying and harassment, and I'm not asking people to leave their jobs, but sometimes it's just good to separate yourself, take a break, get yourself away from that environment so that you can think more clearly and deal with that situation. So relationship problems, social isolation is absolutely important. Don't isolate yourself, find yourself a group, a family, get yourself involved in something. One of my case in points that I like to point out is a woman who suffered with depression almost all her life. By the time I was seeing her, she must have been 31, 32 years old, Caucasian lady. And all we did was I encouraged her, like I encourage a lot of my patients, to go and volunteer somewhere, go do something outside of yourself. Stop thinking about just yourself. So she loved animals. So she went to this animal shelter where there were horses that were injured, being looked after. Do you know what? She eventually got so much into it that not only did they offer her a job in the place, but she actually came off medication completely. So there are certain things that can help our mental health. There are certain things that we can do to prevent these things and stop us from getting there. Access in terms of how we engage with health services. A lot of people, the number one reason why people don't talk about their mental health is a stigma, that maybe there's something wrong with me. Maybe I'm not as strong as everybody else. We need to get rid of that stigma. We need to be more welcoming. One of the things I've been encouraging a lot of people to do, and I know I'm going to sound like Oprah Winfrey, but I've been encouraging people, let's be more kind to each other. Let's be kinder to each other. You don't know what the other person is going through, because this pandemic has affected people in many different ways. People who ordinarily were strong they're suffering in this. So sometimes just being kind to each other as a community on a one-on-one basis makes a huge, huge difference to how it's going to affect someone's mental health. I talked about the fact that often depression can come out as irritability, anger, outbursts, hostility. Some of those guys I see, especially the men who are angry all the time, they show a lot of hostility, they may just be depressed. They may be depressed. Even when you talk about people who are always having abdominal problems or stomach problems or migraines, part of the problem, sometimes when I've dug into it, there's an underlying mental health problem there. Just a young lady came to me just 2-3 days ago, 23 years old. She's been having abdominal symptoms. They've scanned everywhere that was scannable. They couldn't find everything. By the time I was seeing her, I began to ask searching questions. And she just broke down in tears. It turns out when she filled my questionnaire, she was severely depressed, severely anxious. So sometimes things are deeper than what we see on the surface, is basically what I'm saying. And so this is why I'm saying that mental health is a difficult subject for both the public and for health professionals, because it's not something that you can see. It's not something that is obvious to us. Look at post-traumatic stress disorder. People have suffered things in their childhood. It's affecting them today. People who have suffered things from past relationships, it's still carrying on till now. And it takes a bit of patience, a bit of love, a bit of kindness sometimes, or just time to be able to look into it. Counselors around here will tell you to be able to search into it and find out what exactly is going on. One of the things I've also been encountering is undiagnosed autism, especially in adults, or undiagnosed ADHD. A lot of people, not a lot, some of the people in the criminal justice system, especially among the Black men who have been involved in violence and things like that. Some of them have undiagnosed ADHD. There was a particular case in point of a chap in London, I believe. His was not even ADHD. He was in and out of prison. By the time they checked into it, he actually suffered with Klinefelter syndrome, which is a chromosomal disorder. He has an extra chromosome, which makes him more aggressive. And so if we don't recognize those things, if you don't see those things for what they are, you're just going to think that this person is horrible, this person is bad, this person is just an evil person. Sometimes they're not. That's the point I'm making. Of course, there are some people who are bad and evil, etc., but sometimes they're not. There are underlying things that can mask themselves in a certain way, and if you're not looking at it, you won't see it. And like I said, this is like a silent epidemic. It's going on all around you. That co-worker who gets easily offended. You don't know that somebody has already offended her in the past and done certain things, and that's why they are reacting that way. They're simply reacting to you based on somebody else's offense. I'm not justifying this. I'm not saying it's right. I'm just saying that a lot of people suffer with mental health. They're not even aware of it. They don't even know it's there. Undiagnosed anxiety, depression, bipolar, obsessive compulsive disorder, always wanting to check the gate, always wanting to lock everything up. Visitors cannot come to your house. You're hovering while they're at the door, or even before they leave the house. Some of you are laughing. I've seen this happen. We go to visit this lady. As soon as we get up to go to the kitchen, she's arranging the puff and getting the hand hooverer. We've not even left the house yet, but she's already hoovering after. She can't even help herself. It's undiagnosed. But my point is that what I have found to be quite helpful is be kind to those kind of people, and sometimes just helping them see that this is a situation that you can get help with. You can get help with. Some of these things are actually quite easily treatable when it's looked into. Let's look at some resources around us. Now, I work in Rochdale, and so some of the things around me in Rochdale may not be available. There are some things that are universal across, Greater Manchester. There's an organization called Relate that helps with relationships and everything like that. I know in CAHN we have a fantastic counseling session and a couple of wonderful counselors who the services are available. But I'm saying in the general population, there's Relate, there's Healthy Minds, Healthy Young Minds, that will provide CBT, cognitive behavior therapy, and things like that. These are really, really important resources for us to take advantage of. Also, if you think someone or even yourself may be suffering from ADHD or autism, and you're above the age of 18, there is late onset diagnostic clinics available within the NHS. Your GP can refer you. Why do we need a diagnosis? Number one, you may benefit from having medication. It may well be that you could do with medication that would then help you to be more socially amenable, that you can relate to people more, you can exist more. Because some people that suffer with ADHD, for example, they can't hold down a job. Their attention, they're doing one thing today, they jump into the next thing. And, in my culture, we think about them as being irresponsible. Come on, you're a man. You've only had this job for 3 months, and then you've jumped to. Some of them have ADHD. They can't concentrate. They can't be in that environment. So from my point of view as a clinician, my job is to try and find, how do we help these people? How do we, first of all, identify this problem? How do we diagnose it? So there's a service that helps in the late onset diagnosis, especially autism. There are a lot of people within the autistic spectrum. If only we knew what we knew now 20, 30 years ago. There are a lot of people that have suffered a lot of things, that have crashed out of school. They could have received better help. They could have stayed in their relationship. Marriages would not be broken. Relationship between father and son would not be estranged if only we understood that they were on the autistic spectrum and they could have gotten help. So it's really important that we look at all the resources around us and we go and take advantage of it. Like I mentioned, within us here in CAHN, we've got the counseling unit, we've got counselors, we've got people that help with that. They're available for us to take advantage of. I'm sure the details will be put in the chat box. But within the NHS, let's not shy away from taking advantage of using these resources that will help us get the help that we need. Because sometimes the issue is access and the issue is stigma. And we've already established here that a lot of times in the Afro-Caribbean community, access is more limited to us than to the average population for a number of reasons. There are barriers within language, there are cultural barriers, there are religious barriers. There are some people that don't believe that as a Christian, you should suffer with mental health, or as a Muslim, it's not acceptable. I've treated a lot of Muslim patients where within their culture, they're afraid to come out because it's generally not an acceptable thing that you're a Muslim and you have mental health, and so the family tries to cover it up. They don't allow them get the help that they need. The same thing in some Christian circles as well. It gets covered up, it gets covered, and unfortunately, it gets worse and worse and worse and escalates to the point where that person now becomes even worse, and the condition deteriorates. As with most things, mental health is no different. The earlier the diagnosis is made and treatment is institutionalized, the better the outcome. The good thing about this is that it's not like cancer where there's some kind of terminal thing, but what I have found is that the impact of mental health can be so devastating that it literally robs people of their lives. Remember my definition that I said at the beginning, that it's a state of well-being in which an individual realizes their true potential. Many people don't recognize or realize their true potential. They're able to cope with the normal stresses of life because life is stressful. If you ever had a child, it's stressful. If you're married, it's stressful. I jokingly said to a 20-year-old the other day, a lady, she said she's stressed. I said, you're not married to a woman. How can you be stressed? Okay, that was a bad joke. But there are certain things that will stress you. Living with somebody else, going to work, having to pay your bills, just normal stresses of life. But we should ordinarily be able to cope with those things. Now, when we're not coping with those things, we need to look at ourselves and look at the people around us and say, is there something else going on? Unfortunately, across Greater Manchester and indeed nationally, mental health is one of the most under-resourced parts of the National Health Service. That is a well-known fact. Part of it is because of what I mentioned earlier on. If you are bleeding, if you've got diabetes, we can see what the problem is. And so, a lot of resources have been committed into that. But if you've got mental health and you're withdrawn to yourself, you can't come out of your house, you're not able to socialize, you've got social anxiety, or you're not doing well in school because you just can't stand being around other people. People look at you like, are you lazy? Or maybe you just didn't want to go to work. And so there isn't as much sympathy because it's not something that we can see. It's not something that we can put a hand on. And part of my job today is just to try and shine a lot more light on the fact that there are a number of things that are going on. A lot of people around us that are suffering with mental health if only we'll get the right help. In one of my previous talks, I talked about the spectrum of mental health, starting from, if you like, simple things like, which is by far the most common, anxiety and depression. I call it simple. It's not simple for a lot of people, so please don't get me wrong. But there are other more complicated, less easy to diagnose things. Bipolar affective disorder, for example, it's very, very difficult because a lot of these individuals are high-performing, high-achieving individuals. You will never know until there's a trigger, and then they have a breakdown. People who suffer with autism, until you have a trigger point, you won't know, it won't manifest. Things like post-traumatic stress disorder, for example. So there are other things, or schizophrenia. There are a lot of people who are suffering or other types of personality disorders, narcissistic personality disorder. They exist perfectly fine. They're doing, they do normal things. They exist normally, they function normally until they have a trigger. So I'm going to round up by saying that it's really important for us to make sure that we try to seek help. Don't avoid getting help. The first step to getting to where we need to get to is to begin to say that, look, maybe there might be something wrong with me and I need to try and get help. That's the first thing. And if you think somebody may have and they're close to you, or if you are the person, because what I'm seeing a lot more recently is a lot of people who have suffered with mental health for long periods of time, and they're only just beginning to come out of it. I'll ask them, how long have you felt like this? 4 years, 3 years, 5 years, 10 years. and they've lost jobs, they've not finished school, they've had issues because they've kept this hidden to themselves, whereas they could have received help and been assisted. So I'm going to stop there for now and see if we've got questions. I know normally we like to have questions. Over to you, Ngozi. I think you're still muted.
They'd muted me and I couldn't unmute myself. Yeah. Thank you. That was really, really great talk. Thank you so much for that, because I think it's really important that we have these talks to try and understand, but also to look after ourselves, because what we have to accept and acknowledge is that there is a general stigma about mental health. It's very different if you tell somebody, oh, I've got cancer. There's suddenly an outpouring of support and inquiries about your well-being. But if you say you have mental health, it's just a bit different. And I think that's long-standing because there's a lack of understanding and awareness of the things behind it. I know when I was young, you'd have people that would say, well, I'm not going to marry into that family because there's madness in that family. But if there was cancer, that's just taken as a given, So there is still a lot of stigma about mental health because it's, I think it's something to do with the background understanding. So because of that, I think we don't actually come forward. And I know even ourselves in the medical profession, you're seen as being a bit wimpy, not man up and try and pull yourself together if you are off with stress or a mental health issue. I mean, I've been at work when someone will say, what's wrong with, where's that person? They're off, and there'll be a bit of eye rolling, again, because there isn't the same level of acceptance, I would say, and that's general. So we can have all these talks, but it's really about getting to the root problem and making sure that we all understand it and accept it and provide help and that signpost people to the right places as well. I'm really pleased that you touched on COVID, because I think apart from the devastation it has caused, one of the things it has done is that there are more mental health issues and it's allowed people to come forward. So within our organization, where I work, there's now a lot of burnout. People have been going at high level. You can sustain working at a very high level for a short period of time. And if you have a trough, you have recovery, but there's been no recovery. We've been working like this for such a long time that there is genuine concern about burnout for our doctors and nurses. So those of you in the health profession that are here today, I hope you've taken some of the tips that Dr. Joe's provided, because it's important for us to keep healthy so that we can provide the best healthcare and outcomes for our patients as well. So one of the things you said is ask for help. But, my concern is that asking for help means that there has to be a degree of self-awareness and recognition of the problem without the stigmatization. And how in your practice, do you see that as being different between, this is the Caribbean African Health Network. Is it still different for people of a Black background compared to our white counterparts about stigmatization in mental health?
Oh, yes, 1000%. 1000%. It's while there's a general stigmatization in the general populace, within the Afro-Caribbean community, as a matter of fact, a lot of ethnic minorities, Chinese, Pakistani, Indian, but especially there's still that thing where, you're not allowed to be mentally unwell. You're seen as being weak, or you're seen as if there's something going on with you, or it's a spiritual problem. That's the most common one, that there must be some kind of demon behind it. And I'm a religious person. I'm a person of faith. What I've often found is that many times I'm able to distinguish, luckily, between what is spiritual and what is not. Many times there's nothing spiritual about what's going on. People are burnt out, people are stressed out. I'm glad you highlighted about healthcare workers, especially, but not just healthcare workers, frontline workers. A lot more teachers are coming down with stress and needing time off. They've been working solidly around the clock. A lot of nurses, firemen. I'm talking about people who are, sorry, not to be chauvinistic, who are proper men, and then they're breaking down, they're crying. People who are strong characters, women of strong character, and then all of a sudden, because of all the pressure, the sustained pressure from COVID, from the lockdown, they suddenly find out that they're cracking. And so this is one of the reasons why I just thought, because I was privileged to be on a BBC program when the mayoral debate was going on in Greater Manchester. And one of the things I said to them was, all of us, from the top to bottom, we need to shine more light on the fact that there's a lot of mental health things going on, and there's not enough resources or attention being paid to it. And I think for us, because we are very, especially the Afro-Caribbean network or communities, we're more family and community oriented. Let's be more aware of it. Let's be kinder to each other. Let's be more, let's have a more high index of suspicion to be able to see it and identify when this is going on and when this is more likely to be something to do with mental health, rather than just a case of somebody not pulling their weight.
Yeah, I think that's important. And I think there's a number of questions about whether they can get the PowerPoint. Elizabeth, yes, they can. If anybody's asking that question and listening, you can get the PowerPoint presentation. The other thing is the stress about the general stress about the vaccine. So we heard the other day that they're going to make that compulsory in healthcare workers that work in a care setting. Yeah. That hasn't been extended to hospitals yet, but it could be. What's your view on that?
I
general, we're just sort of having a general discussion, because it can be associated with, I mean, there must be people out there who decided, I'm not going to have this vaccine, and now they're in a quandary about being vaccinated and perhaps losing their jobs. Just to put it in context though, one of the things I thought I would mention is when this came up, I was saying to somebody I know who doesn't work in healthcare, I said, but do you know that as a healthcare worker, I have had to have a compulsory hepatitis B vaccine forever. It's not a choice. If you don't have it, you can't work. So compulsory vaccinations are not new. Yeah. It's just that in the context of COVID, where there has been an element of choice associated with this vaccine, it does seem that this is one that is a bit more in the public eye. But just to put it in context, compulsory vaccinations are not new for healthcare workers. Yeah. So Dr. Joe, myself, if you don't have your Hep B vaccine, you won't be allowed to work.
You can't work. You can't work in the NHS. Yeah. So my view is this, that I agree with you 100%. We've been on panels together. We've been privileged to talk to the vaccine minister. My view is that everybody should get it. However, I don't think it's a good idea to make it compulsory. The reason why I say that is because there are people who have genuine fears, genuine concerns about the vaccine, and the conspiracy theorists, I think it may be feeding into their beliefs if they decide to make it compulsory. If I had my way, would I make it compulsory? Absolutely. But I don't think that this is the way forward. I don't think that making it compulsory or people will lose their jobs is the best way. I think we should keep persuading people. Just yesterday, I read about a chap in Texas or Atlanta, somewhere in the US. He was somebody who didn't believe in the vaccine, didn't even believe COVID existed. He needed a lung transplant because he had COVID. It was so bad, his lung collapsed. He's only 40 something, 47, very young. Okay. Now he's the one now telling people, please go and get the vaccine. So I think some people need to be, that is just my view. I think some people you just need to leave them alone and allow them make that decision. And That's the way I feel about it. But obviously, if I'm to say what I think everybody should do, I think everybody should get it and get a booster in October. In fact, as well. That's my. But making it compulsory, I'm not sure is the best way forward.
I think I would echo your views on that, because I think that the thing about the hepatitis that I gave as an example, you knew that before you entered the profession, you started working, that you were going to have to do this. So you had a choice. If I really do not want to take the Hep B vaccine, I won't work. Now there's an element that you have been deprived of choice in a sense.
Exactly.
So whilst everybody will know my views that I think it's really important for you to get vaccinated, I do have some concerns about making it mandated, because anything you make mandated just has a connotation of being sort of the state interfering with personal autonomy.
Yeah.
And that just doesn't seem, for even people that believe in it, there's something about enforcing people that you've got your own free will. And I think the way to go, just as you said, is to try and continue to be supportive, continue to supply the facts, and let people come to this choice by themselves. Because you know what? Nobody, even the vaccine, people who are hesitant or don't want to take it, everybody wants to have a good health.
Absolutely.
So you ask people, what do you want? Good health or poor health? Everybody will say good health. So what you need to do is to explain why this is helping you to have the good health you so desire, because that's what's driving their concerns about putting a chemical in their bodies that they're not sure about. It's about the impact on their health. So unless we can convince people that, look, this is good for you, and once you've done that, then they will make the right choice.
Yeah. No, I agree with you 100%.
Yeah.
I agree with you 100%. You see, it's like when we joined the NHS back then, I think one of my first jobs was obs and gynae, through no fault of mine. And no offense to the gynecologists and their friends, but I never wanted to do obs and gynae, but that was the only job available. Now we had the option of whether we could perform terminations. As a Christian, right from when I was in medical school, I opted out everywhere that I go. I do not want to perform terminations. And so it was an option for me, even before I started the job. And I opted out till date. So it's important to still give people that element of choice. And I think we're winning. We have an advanced practitioner who, at the beginning, she was like, no. She's Afro-Caribbean, interestingly. She's mixed race, half Scottish, half Caribbean. She was like, no. She's not having it. We just left her alone. The rest of us all took it. People were rushing, scrambling for it. We all got it. Last week, she was telling me, oh, she's had her first jab. Like, really? Like, well, she had to think about it. Patients are now coming in. She's worried about her health. So she's gone and had it. Now, if it was made mandatory, there will be some underlying, begrudgment there, thinking, they've made me do it. And I think it's against the human rights law. The European courts will have a field day about it. So I think the government needs to have a rethink on that.
We're not in Europe anymore.
Well, I keep forgetting. I'm a Remainer at heart, so hey.
Me too. One of the things you mentioned, you touched on, was about that you said you're a Christian, and you talked about spirituality and mental health. And you said that you can distinguish between the two. So that means that in some cases, is there some grounds for spirituality and mental health? Because I know I have my views, but I'd like you just to explain that. Some people might be listening in about the interplay, I would say. Because you see, I think people say, well, there can be, because it's in the Bible. That's what I get told. And so you give a view, or
well, thank you very much. I believe there are certain, the problem. Let me start by saying that, like I alluded to in my talk, most of us in the Afro-Caribbean community, when we don't understand something, we immediately attribute it to something spiritual. Because we don't understand how this has happened, we think, oh, there must be some God or spirit or demon behind it. That's not what I'm talking about. The fact is, in my practice in the last 21, 22 years or so, or more, and also the last 30 years of being a Christian, I have seen genuine cases of mental health that were totally spiritual. There wasn't anything they could have done. They were just demonically oppressed. And so there is an element of that. There's a debate going on right now in some of the colleges in the US, actually, about including prayer in hospitals, the role of prayer, because people are beginning to realize that the dimensions, I like to study it and read all these papers because it intrigues me. The people are beginning to realize that apart from the psychological element of illnesses, which is now well documented, which wasn't there before, there might be a spiritual element of illness, which we haven't really tapped into. So there's a debate going on. Is prayer important? Because the research suggests that people who are prayed for, whether it's a psychological effect or not, tend to do better. It's empirical evidence. They tend to do better. Outcomes are better. Surgical outcomes are better, etc. But if you're asking me from my experience, because I play a dual role as a religious minister as well as a doctor, I have seen cases where the problem is a spiritual problem outright, as opposed to being a mental health problem. And you need to be able to decipher that and distinguish that. Part of it is what we do in medical school, history taking. You take a bit of history, you find out, because like we have in chronic illnesses, diabetes, hypertension, they run in families, but there's no genetic component that says that if your father has diabetes, you must have diabetes, but there's a more likelihood. Unlike sickle cell or Huntington's chorea, where if you have the genes, X-linked or autosomal recessive, 50% of your kids are going to get it. There's no choice in that. That's a genetic problem. So in terms of mental health, there is some kind of inherited forms where you're more likely to get it, partly due to your upbringing, your environment, and internal stuff. That's not what I'm talking about. I'm saying that there are some things that are outrightly spiritual, and you need to be spiritual to discern that, to see it. So I have seen that. And if you were to ask me, yes. A vast majority, however, I must say, and have nothing to do with the spiritual. I would go as far as saying 60, 70%. There's nothing spiritual about this. It's purely a mental health thing, response to medicine, even almost 80%. Response to medicine, it's all these things that we've discussed. Because, if you look at it, for example, I'll give you one illness as an example, and I'm not overgeneralizing, but and depression, for example, a lot of people that have depression also have a history of someone's hurt them, they're holding a grudge, and that grudge then eats them up within, builds up into something else. You could argue that maybe they've allowed some kind of spirit, but if they didn't hold that grudge, that wouldn't be there. And psychotherapy takes care of that. That's what cognitive behavior therapy helps you to do. It helps you to confront, why are you thinking the way you're thinking? Could you be thinking in a different way? So there's nothing spiritual about that. It's you now changing your mind and now accepting of the situation. Once you change your mind and move away from that, you begin to get better almost without medication. I don't know if I've kind of answered your question.
Yeah. On behalf of the people listening in, I think that's really interesting, Dr. Joel, because I've seen those papers about prayer as well. But one of the things is that they say, I think if I remember well, that you have got to have an element of belief. So, how sometimes we meet people who have a devastating disease and say, I'm going to beat this. And you have a sort of attitude to making sure you take care of yourself. And that attitude prevails in your psyche. There's some people who sort of give up. Now, you might think this is kidney disease. It shouldn't really matter if you have two people and one decided to give up and one decided that I'm really going to fight this, because the disease is there. But in actual fact, there is an interplay in all health. We always say, try and look after yourself, because there's an interplay with how you approach things in terms of saying that I'm going to try and look after myself better. And I know I've got this diagnosis, but I'm going to do the best I can, towards sort of giving up. And you can actually physically see people sort of giving up and just thinking, I'm not going to take any responsibility for this in a way. And part of the reasons why we do this every week is for people to take a more active role in their health. Yeah. So someone's giving you a diagnosis, that doesn't mean that that's it. That means that you have to, and nowadays it's partnership between you and your GP. It's you taking some responsibility of what works for you, discussing with your GP. So whilst you've described a spiritual connotation to mental health, that can only be ascribed though to people who have a sort of religious view, can it? Or is it just completely devoid of whether you're religious or not?
Well, sadly, whether you have a religious view or not, people will suffer with mental health that have spiritual connotations, whether you believe in it or not.
Okay.
There are people who have frank. Look, I'll give you an example. There was a chap. He was Asian, sort of Chinese, Malaysian. As he came in and as he began to speak to me, he was describing these voices that were, and as he was speaking, there was a cold chill that came upon me. And I just told him, look, this thing you're describing, these are demonic spirits. These are not, I've read about them as well, that aspect. These are demonic spirits. And the way he described it, there was something in me that knew that he didn't have any religious belief, etc. But I just knew. And I told him, I asked his permission, as we have to do these days. And I began to talk to him about spiritual things. And we had an interesting discussion. And he said he was going to go look for a church, a mosque, and they would pray for him, etc. I also gave him all the medical information. But it doesn't really, you don't have to, whether you believe in it or not, there are demonic spirits out there. There are things out there that are, you see, I don't want to turn this into, but it might help somebody. There are certain things that people do that land them into the hands of the occult and people get themselves involved in things they don't even understand. For example, palm reading, Ouija boards, and things like that. Some of these things are demonic practices that people inadvertently get themselves involved in that acts as an entrance point for a lot of people, where you now begin to feel demonic oppression without necessarily believing in anything. You didn't plan it, you didn't want it. People go for seances. They want to talk to the dead and things like that. Clairvoyance and things like that. Now, people may have a different belief, but I have seen in my practice that a lot of these things are what affects people, and then they start manifesting mental health. But when you dig deeper, they have all these funny things that they've dabbled into, that a lot of times when we've done all the research and looked at all the cases, they might just be entrance points where demons are able to, or these spirits are able to get in. And once you take them away from that environment, this is the key, Ngozi. Without medication, once you take them away from that environment, that spiritual thing, that seance, they get better. So I have tested it in my practice, where you don't have to come to my church, or let's just remove you from that environment where the clairvoyance, the palm reading, etc., and denounce it, and they suddenly start improving. So, time will not permit for me to talk about a lot of my experiences, which is not necessarily what I want to talk about, but generally what a lot of my colleagues have seen. I have a lot of friends who are psychiatrists. Right from medical school, one of my interests has always been psych. Interestingly, I never wanted to be a psychiatrist, but I speak to them a lot. I read a lot about their papers and all of that. And they tell me similar things about the fact that there are certain things that they can't explain with all their medication and all their psychiatric stuff. And for those of them who are not spiritual, I often tell them, you have to look beyond this, these two dimensions. There's a third dimension where there's the spirituality. And if you're not attuned to it, if you're not open to it, if you can't discern it, you won't be able to operate in it. You won't be able to help these people. Now, whether you believe in it or not, the influences can still be there. But for you to be able to deal with it, you have to believe in it, if that was the question.
Okay. I think it's a really, really interesting discussion. It's a really interesting discussion, because we actually have, I suppose, I'm a bit more skeptical. Now, my background is not in GP land. I work with premature babies, so I work in the hospital all the time. Yeah. So obviously I don't have this kind of expertise that Joe has, but my view has always been, I'm quite scientific. Yeah. So here we've got somebody who has a religious background and uses that appropriately within his faith. And you've got me on the other side, who is really scientific and believes that the basis of all illness is science, in a sense. So I think it has made for an interesting viewpoint on both sides, because I think everything, and the fact is that even though I work in hospitals, I am really scientific. there are times that I look at some of my patients, and you have got to accept that there is, the fact that the way things interplay and how our bodies work, it's just so special in a way that it does make you wonder, why this baby is premature, or why has that baby got this problem. It's really, really interesting to me.
I'll give an
But the other thing that I was just going to say before I hand over to you is that I think toxic environments are bad. So anywhere that's toxic, what you've described, and that just removing people from that toxic environment. So I've had colleagues where you're working with another group of colleagues who they just do not like you, you don't get on, and coming to work every day causes you stress.
Yeah.
And that, on a prolonged basis of time, will cause you to feel depressed as well.
Okay.
Remove that person from that environment and they're a new person.
Yeah.
So some of the things you've described, I see it in my head like that. It could be that you might choose to describe it in one way, but I just say it's a toxic environment. It's an environment that is not good for your spirit. It's not good for you. And everybody must have experienced this, where if you're a worker or you're at home and things are not going well, they just need to change things up a bit, or the problem has disappeared. It might be a problem with debt. It might be anything. Yeah. Once you solve the problem, you just feel a weight off your shoulders, off your being, and you feel better. And I wonder that sometimes, the places that you describe that people go, they're looking for answers. Yeah. So why would you go for a palm reading if you've got, why would you? I find those things difficult because I just don't believe in them. Now, some people do, and we all come with our personal beliefs, but I don't believe in the Ouija boards and palm reading. But some people say that's their thing.
People swear by it. People. This is you've raised it. It's very intriguing because I love speaking to my professional colleagues. I have interesting discussions. It's my advantage, like you said, is that, for all intents and purposes, I went to school, right? I have membership of the Royal College. I read research papers. I see the science. And if you see from my presentation, I hope we're able to share the slides to everybody. I try to keep it simple, but it's all evidence-based. There's nothing there that you cannot source the evidence for it. And I believe in that. I believe in the scientific aspect of things. People are looking for answers. I don't want to turn this into, we may have to create a session to look at the
In actual fact, we do have a session first week in July. I decided to do that session that looks at, I've got a doctor coming who's got a faith background, a Christian and a Muslim. I think you should join that session as well.
Fantastic.
So he's a hospital-based doctor. So you as a GP would be great to join that session.
Yeah,
I just thought it was important because every session we do, I always get a few questions. People send me personal questions about alternatives to medicine. So I just gathered that it's important to people to think about that aspect because people do.
We have to talk about it in Ngozi because, like I said, even in the powers that be in the healthcare boards, they're beginning to realize that people are turning. There are people within the subcultures, that the more ethnic minorities, the Pakistanis, the Indians, the Afro-Caribbeans, who have these beliefs very, very high up on the agenda in their minds, and whether rightly or wrongly, it affects the way they interface with medicine and how they interact with medicine. Now, to come to the issue of spirituality, and people are looking for answers. And this is my belief, that we were created in such a way that there are three dimensions to us. We're not just physical human beings that interact with this world. There's a spiritual element to us. And so no matter how learned some people are, they'll still look for that aspect, whether it's Ouija boards, whether it's church, whether it's mosque, people will still look for some element of spirituality. Now, I can speak mainly from my area of expertise, which is the Christian aspect, because I went to Bible school. I have a degree. I went to Bible school. I have a qualification. I studied theology. So I'm not just sort of, it's something that I've studied. So I'm privileged to be able to look at things dispassionately. And there was a time when I just thought everything is medicine and all that, but my faith has helped me. So I'm able to look at things from both sides and see, because even the people in the scientific world who are strictly scientists are beginning to realize that there's so many things that we can't just fully explain. I'll give you a typical example. My baby was born in your hospital. She was in your unit, actually. The professor, I don't think you were on there. I think it was either your husband or one of the colleagues that delivered her. But my wife had a uterine rupture. I've said this in one of the previous. She had a uterine rupture. Baby had to be delivered. For those of you who are not medical, that's a medical emergency. The baby could die. The mother could die. Fortunately, that didn't happen. So my baby was born, and they said she had been deprived of oxygen. So she was put in an induced coma. Interestingly, neonatology was not my thing, but I've done a little bit of it. I've done about 12 months of neonatology. So I knew what they were talking about. They induced her into a coma to rest her brain, to reduce the brain swelling, et cetera, et cetera. I've worked in SCOBU. I've taken blood from tiny babies. I know what they were talking about. But as they began to speak, this young Asian registrar, I'll never forget her face, she began to tell me all the prognosis. And I said, stop right there. This is not going to happen to my baby because I have prayed. And she said, oh, I thought you were a medical person. I said, I am, but I'm also a person of faith. She said, okay. She wasn't very happy with me. She went and got her professor, an elderly looking chap. I don't know if he still works. I can't remember his name for the life of me. This is going back 9, 10 years ago, 11 years ago. He came and said, I understand that you contradicted our registrar. I said, yes, I'm a GP, fully qualified. I said, I understand everything you've said, but I don't think that's going to happen to my child because I'm a person of faith. They said she was going to be in an induced coma for 7 days. To cut a long story short, the next day she pulled out the NG tube and she began to look for food. So they had to get my wife to come and express. Her recovery, they said, was miraculous. This not my words, their words. It shocked them so much that she was followed up for 2 years. They just couldn't believe how much progress she had made. Now, we can quote all the statistics. I love statistics. I've given you some today. You can talk about the statistics. What I'm saying to us today, that there is a spiritual dimension to our lives that we need to pay attention to. I don't scoff at people when they tell me, oh, there was a lady who said, I'm going to ask my pastor before I take blood pressure tablets. There are people like that. And I told her, I respect your view. Go and ask your pastor. Interestingly, I happen to know the pastor. That was interesting. So I rang the pastor up and said, if anybody comes and says, should they take blood pressure medicine? Please tell them to take the blood pressure medicine. I was cheating them. But yeah, I happen to know the guy, Congolese chap. I called him up. I said, dude, if somebody comes and says, should I take blood pressure? I don't know when they're going to come to you. The lady came back 2 weeks later and said she had spoken to the pastor's wife and that both the pastor and the pastor's wife were in agreement that she should take the medication. I said, praise the Lord, please take the medication. So I believe very much in medical science, but I also believe that there is a layer that is above that attention needs to be paid into, that medical science hasn't quite grasped a hold of. And that shouldn't replace our knowledge and our application of things. And, like you said, looking after ourselves, trying to take care of these risks that I mentioned, staying away from alcohol, drugs, toxic environments, making sure your health is good, not smoking, etc. And also just being kind to one another and looking out for one another. Nothing replaces that.
Thank you, Dr. Joe. I think this, again, has been another really interesting session, and I think validates the session, the decision I made to have the session on the 3rd of July, because I do feel many of us that attend these have a religious faith, and it would be interesting to talk about the interplay between that and our health as well. And I think there's a place for faith, absolutely. I always say to my patients, and when I always say my role is to deliver the information that I've been given, that I've been taught about what your baby does, but what your role is is to support that with whatever belief system you have. And so those that want to pray at the bedside, I encourage them to do it. I say, because that's something that, is that you can do for yourself and your baby. So thank you for that story. He's still there and he's still as belligerent. So I'm going to hand over to Elizabeth. Are you going to tell us about what we're having next week? Really exciting week next week.
Hi, yes, Ngozi. As we all know, so thank you for that, and thank you, Dr. Joseph, for your presentation. Yes, so on Wednesday, the 22nd of June is Windrush Day. And every year here at CAHN, we have an annual flagship event in celebration with Windrush. And we will be hosting that next week, Saturday, from 1 p.m. till 4 p.m. And that will be on Zoom. My colleagues will share the flyer and the booking link in the chat box. If you haven't already registered, now is the time. We are still taking bookings. Tickets are still available. What's in store for you? We will be having some live cooking demonstrations. We'll be having some quizzes. Which prizes will be in order. So definitely you can win something next week. We will also be having some poetry and some presentations, and some dignitaries that have also confirmed that they will be coming and blessing us at the event next week. So if you haven't already registered, definitely register now after this call, and share that with your friends, family, colleagues, and let's all come together to celebrate Windrush and celebrate our achievements and successes as a community. Yeah, so that's what we have for you next week. Over to you, Ngozi. Yeah. No? Okay. Yeah, so we'll be back.
Did you want me to say something?
No, just for the health hour next week, but it's okay. Yeah, we'll also be back again next week, Saturday, with our health hour session as well, from 11 a.m. to 12:15. We also have our Healthy Hearts next week, Tuesday, from 6 till 7. So please tune in, and we look forward to seeing you all. Have a lovely afternoon.
Have a nice Saturday. Bye.
Bye, everyone.